Hello and good evening, friends. I'm Dr. Mukhmohit, and we are here today for discussing the recent updates that we have in community medicine. So I believe that most of all of us we know that the recent updates in all the community medicine are pertaining to the national health programs. So I'll just take this opportunity to discuss all the national health programs and what are the recent updates. So hope they'll be useful for you for all the PG entrance exam which are coming up. So let me first talk of the first topic that is National Health Mission. The broad objectives of the National Health Mission are we want to reduce the maternal mortality rate. We want to reduce the maternal mortality rate to less than 100 per lakh. This can also be like it can be it's one and the same thing that you want it to be less than 1 per thousand live births. So well, that's equal thing, 100 per lakh live births, or you want it to be less than 1 per thousand. The second target of the National Health Mission is to reduce the infant mortality rate to less than 25 per thousand live births. And the third important target is to reduce the TFR, that is the total fertility rate, to 2.1. These are the gross big targets of the National Health Mission. Apart from this, we also want to reduce we also want to reduce the anemia in females who are age in the WRA female. So another important point number 3, is to decrease the anemia levels in females. Fourth important is to decrease tuberculosis incidence and mortality, TB incidence and mortality by half. So these are your important things from the National Health Mission. If we talk of two important programs, that is the malaria program and the leprosy program, please remember that the leprosy targets NLEP, which comes of course under the National Health Mission. For the leprosy, if we talk of leprosy, the target is to have less than one case per 10,000 population. And for malaria incidence, we want the annual malaria incidence. We want the annual malaria incidence to be less than 1 per thousand cases. So that's for the National Health Mission. So one more thing was regarding Kala Azar. Kala Azar is also taken as the prevalence has to be less than one case per 10,000 population in all blocks. So that's all for the Kala Azar, National Health Mission, leprosy, TFR, IMR, and the maternal mortality ratios. The next thing that we would take up is questions from National Rural Health Mission. So if we talk of National Rural Health Mission, the recent update is that NRHM, National Rural Health Mission, which was comprising of all the PHCs, CHCs, and the services rendered over there, it has been now to the dedicated program objective is to have RMNCH plus A services. So it is focusing on reproductive, maternal, newborn, child health, adolescent health network using the network of the ASHA, ZNM, and the Anganwadi system. So under this, there are a couple of MCQs which are being asked regarding the various initiatives of NRHM, and predominantly you have a couple of questions asked on ASHA. Please remember the ASHA has to be a literate female. She has to be a literate female, preferably 10th pass, and she should be a female from the village, and she should be married, ages 25 to 45 years, and she should be married, female, and a resident of the village. She should be married and resident of the village, and that's the most important thing. Then they also ask you a couple of questions upon the Angan, and please remember that there's a lot of controversy upon Asha. Everybody's saying like different protocols are saying different things. So I would like to clarify that Asha, the minimum requirement of Asha is one Asha we need for 1,000 populations. That's the current guidelines, what they are saying. Then there are a couple of questions on the Anganwadi workers. Please remember that the Anganwadi worker is under the ICDS program. Under the ICDS, that's a altogether different program. But they ask a couple of questions. The population ratio for Anganwadi worker has to be like one Anganwadi for 800 population to 1000 population. The Anganwadi is going to provide benefits to all the reproductive, maternal, neonates, or the child health and adolescent females. And basically, Anganwadi workers, they'll ask us a question that she's a drug depot holder. She's the depot holder for all the drugs for the community, and the Asha is the person who executes it, while the depot of all the consumables or the drugs in the villages is usually the Anganwadi worker. So that's a couple of questions from NRHM. So the next we can have is we've already discussed about Asha's ANM and Anganwadi workers. The next topic that we can have is, important thing is about the Janani Suraksha Yojana. Questions from JSY will be pertaining to an important thing, that what is the use of Janani Suraksha Yojana. The Janani Suraksha Yojana is to promote what? It is to promote, yeah, we all understand it's to promote maternal health and the child health and everything, but the main objective of the program is to promote the institutional deliveries. So we want to promote the institutional deliveries, which will, of course, in a way, secondarily promote the maternal health and, of course, the child health. So there's no age bar on the female, that up to what age, but of course, the female has to be more than 19 years of age. And these are cash incentives. So there is a cash incentive which is being given to the females under the JSY scheme, and that's it. There are like high performing states and low performing states, but I don't think the MCQ would be like what is the cash amount in the LPS or the low performing states or the high performing states, but that's it that you need to know for JSY. The next we can take up is the Janani Shishu Suraksha Karyakram. So that's a recently newly developed system. And what is the use or the objective of the Janani Suraksha Shishu Suraksha program? Is that it gives Suraksha, or it gives them health benefits to all pregnant females who are from BPL families or from the rural areas, and the only way that we are doing it is that it is zero pocket expense. So zero pocket expense on the all the females delivering in the public health institutions. So all pregnant females, there's no money for cesarean section, and there is free consumables, free diet, free everything to the all the females. So there is also a free transport facility, and Janani Shishu Suraksha Karyakram is for all pregnant females and for sick children. It's also the free transport is also for sick children who are age up to infancy, that is less than 1 year. They are entitled to receive benefits of zero pocket expense under the Janani Shishu Suraksha Karyakram. So that's it for JSSK. The next is Rashtriya Bal Swasthya Karyakram. That is also a recently developed program in RBSY, Rashtriya Bal Swasthya Karyakram. The program is to identify defects in children. So it basically takes care of 4 Ds. So there are 4 Ds, that is, one is defects, then is deficiencies, then is diseases, and developmental delays. So these are your 4 Ds which we are targeting in all children in 0 to 18. That could be another MCQ, that what age group of children are involved. It's all for 0 to 18-year age group children. So basically in this there are two groups, like they have given a more focused approach to 0 to 6 years, and a different approach to 0 to 16 years. 0 to 16 years, there's nothing new. The existing health facilities are being utilized for providing all the health benefits to all children 6 to 18 years of age, whereas in 0 to 6 years of age, it is managed by the district early intervention center. There's a center known as DEIC, District Early Intervention Center. So these are your DEICs, are your special linkage centers which are established for the Rashtriya Bal Swasthya Karyakram. So there'll be screening at the school level, in the government schools, in the public schools. So that's all part of the whole program. But anyways, that's the MCQs we are targeting at. The next program is Rashtriya Kishore Swasthya Karyakram. So under the Rashtriya Kishore Swasthya Karyakram, this program is for all Kishore. Kishore is an adolescent boy or a girl. So it's for adolescent boys and girls, age group 10 to 19 years. So they have a different thought process. You might be thinking, you might be wondering that just now we did this Rashtriya Bal Swasthya Karyakram, and this is Rashtriya Kishore Swasthya Karyakram, and this also takes into account these age group children. So what's the difference? The difference is that basically this is for counseling. So primarily the program is focusing on adolescents. It's a health program for adolescents aged 10 to 19 years. There is a program for the main focus areas is to have counseling to ensure mental health, very important, ensure mental health of all the adolescents. It is to promote a good transition from the childhood to the adulthood. That is, there is a safe sexual and reproductive health. So there are target areas to promote reproductive and sexual health. So along with that, the focus is to improve nutrition and also to prevent any substance abuse or behavioral counseling. So they are basically targeting to decrease the high risk areas in these children who are having a risky behavior. So that's the whole focus of the program. The next program we can come over to is the National Urban Health Mission. Under the National Urban Health Mission, it's just recently, like couple of years old program. Now it has been merged under the National Health Mission. So we already have taken down the targets for NRHM. So NRHM plus NUHM is what forms the base backbone of the whole country, that is the National Health Mission, which we already have talked. So I'm going to discuss about the salient features about the National Urban Health Mission. So basically, urban health is of primary importance for us as public health providers, that you want to take care of the urban poor and the slum dwellers who are making a major chunk of the urban sector, which is currently living. So the target for population is urban slums and people who are living in below poverty lines in the urban areas. The main program is focusing on strengthening the existing health services, which are now capable of providing a better and a more comprehensive care for these people. So there's a special program under the Urban Health Mission of setting up of urban PHCs, urban CHCs, and urban centers, or urban these thing A&M centers, urban A&M centers. So please remember that urban CHC, it is for 2.5 lakh population in all cities, and it is for a 5 lakh population in metro cities. Whereas urban PHC, urban primary health center, it is for 50,000 population. Urban E&M centers is for 10,000 populations, and we also have urban ashas now. Urban ashas are one asha for 2,500 population. And that's it for the National Urban Health Missions. Another point which the MCQ can focus us on how the state and the center funding is taking place for the urban areas. It is taken that the center is contributing 75% of all the share, and the state has to contribute the 25% of all the states. And there is a special budget which has been allocated from the center government and for the state government. So there's a 75-25 sharing, and they are developing urban PHCs, urban CHCs, A&M centers, ASHAs for the urban slums. So that's it for this program. The next program that we can have is the Pradhan Mantri Swasthya Suraksha Yojana. So under this program, it is to provide healthcare and good benefits of health to all the people, and the main important from MCQ point of view is setting up of like aims like institutions. So all the aims like institutions which are being set up across the country, these are under this program, because we want to upgrade the quality of healthcare services as well as to upgrade the medical education in the country. So this one you can say that it cares for the healthcare and the medical education. So setting up of aims like institutions, government medical colleges, institutes have been given special grants. So there is upgradation of the government medical colleges under this program. So basically they are to promote the health of the nation and the quality of the education. The next program we can land up is to Rashtriya Swasthya Bima Yojana. It's a Bima. Bima means what? Bima means insurance. So it's a insurance policy. So in case of any medical tragedy, or in case of any catastrophic health costs which are there, so this Bima Yojana takes into account. MCQ. It is for which people? It is for below poverty line people and other vulnerable groups who are at risk, and the cost is shared by the center and the state as well. And important from MCQ point of view that there is a coverage of INR 30,000 per year. So on a floater basis, this is per family, utilized by any family member. So it is utilized by any family member. There's a minimal charge, I think that's a 30 rupees charge INR they have kept as a charge for enrolling under the Rashtriya Swasthya Bima Yojana, and it is a part of the health system now. Earlier actually it was under a different ministry of labor, but anyways it's under a health ministry now. So the next is Rashtriya Arogya Nidhi. So it's an important program which many of the students are actually not aware, because of the fact that we are not associated with a special group of population. This is primarily to provide financial assistance to all the BPL patients who are suffering from any life-threatening diseases. So that's all that you need to know. Life-threatening diseases in BPL families, these are covered under the Rashtriya Arogya Nidhi. So there's a one-time grant to every hospital in which the treatment has to be taken care. It's on per patient basis. The grant is given on per case basis to the hospital. So the patient can actually approach the management of the hospital and request or apply for this grant, and the state also has their own grants for this, and they can provide to the patient. Mission Indradhanush, one of the most hyped topics which has been asked a couple of times in the recent exams as well. This was a part of the Universal Immunization Program, UIP. 2020. So this was a part of the UIP 2020. So the mission is basically to have 100% immunization coverage. That's why it's in a mission mode. So it's in 100% immunization coverage by year 2020. So anybody who's vaccinated, not vaccinated, partially vaccinated has to have 100% immunization. It's for 7 diseases, 7 vaccine preventable diseases. The vaccine preventable diseases are DPT, diphtheria, pertussis, tetanus. Then you have polio. Then you have tuberculosis and measles. So that makes out to 3, 4, 5, and 6, and 1 is hepatitis B. So these are your 7 vaccine preventable diseases, and the mission is basically in a mission mode. It is funded by international agencies from the WHO, UNICEF, Rotary, and that's in a mission mode. So there are a couple of changes in the immunization program under this mission mode, and all children have to under the mission Indradhanush. That's the important thing. Then there's a mission Parivar Vikas. So the aim is to provide of this mission. The aim is to provide access to high quality of family planning methods. Family planning methods. So this basically has to promote access to contraceptives to all the service providers, and basically this program is in 145 districts. It is launched in 145 districts with a very high TFR. The current TFR of the whole country is 2.4. We are targeting to bring it down to 2.1, and the only way to do that is to target 145 districts which have a pretty high TFR. And needless to say, these districts and these states need maximum importance. The states are Bihar, Rajasthan, Madhya Pradesh, Uttar Pradesh, Chhattisgarh, and Jharkhand. So these are the states where we are having this Parivar Vikas mission to provide high quality family planning to decrease the TFR in these areas. Next is Project Sunrise. It's a beautiful project launched by one of the most neat and one of the most upcoming programs, that is the National AIDS Control Program. The program Project Sunrise, it's in a project mode, and it is to increase awareness for HIV in all the areas which have very high prevalence. So basically this project is in northeastern states which are highly prevalent for HIV. So there is to promote more HIV awareness in these areas. So there is a target to have 90% maximum people are actually from the intravenous drug abusers, which are left out. So all the drug abusers, they are now targeted under this program to diagnose them and to put them under treatment by year 2020. So that's the target of this program, of this small project, that is Project Sunrise. And it's all funded by the NACO. And I think we all know there's a small update on the NACO as well, that NACO is wanting to have, what is the target, is to have 0 HIV cases in India. And the second important is we are adopting a 90, 90 and 90 strategy. 90% of all cases of HIV should be diagnosed, 90% should be on treatment, and all those who are treated should have a viral load remission. That is, they should have a response to treatment. They should have a response to the treatment. So that's a 90-90-90 strategy. And also NACO is taking care of treat all strategy under this program. The next we can take up program is National Deworming Mission. National Deworming Mission is one of the most important programs that was launched in 2015-16. This is for the fact that we have the maximum, India has the burden of the maximum soil transmitted helminthiasis in the world. And maximum helminthiasis is from Ascariasis, and also maximum helminthiasis, soil transmitted helminthiasis, is from Necator americanus, which is hookworm. So hookworm infestations or ascariasis is one of the most common problems we are facing, and we all know hookworm causes a chronic blood loss and again leads to the problem of anemia. So under this program, there is provision of albendazole tablets to all children age 1 to 19 years. 1 to 2 years of age children will receive albendazole at the rate of 200 milligram single tablet, and 2 years more than that they'll receive at the rate of 400 milligram albendazole tablet. The National Deworming Day is also celebrated on 10th of February and 10th of August every year. So there'll be like twice a year this program will be working, and basically if you're going to mark one, best is to mark 10th of February because that's the National Deworming Day. And that's it for the deworming program. Then is Pradhan Mantri Surakshit Matritva Abhiyan. So it's basically for Matritva, for all the pregnant females. So this program is catering for all the pregnant females for free health checkup and ANCs. So primarily our focus is on providing a good quantity, that is minimum 4 ANC visits, and a good quality of the ANC visits. So all the females who are there in this trimester, second and third trimester, they'll be focused more. Then there is provision of the iron folic acid supplements to all females under this program. We are giving the iron folic acid tablets 6 months before delivery, 6 months before delivery, and 6 months after delivery. So these are your iron folic acid tablets given to all females. So it's primarily given for full complete 1 year. So this facilities are being given under the RMNCH strategy, and along with that there is a blanket 26-week leave policy for all the pregnant females across the country. National Health Protection Scheme. The next scheme is National Health Protection Scheme. It's again a protection scheme. Protection means an insurance scheme. So they can, under this National Health Protection Scheme, the people can purchase policy of up to 1 lakh rupees, and in case of any disaster or any case of accidents or any health disease, they can consume this money. So it's a life health insurance for BPL families. It's for BPL families. It's a health insurance. Universal immunization program, there are 4 important updates. There is update on launch of the 4 important updates are launch of the pentavalent vaccine. Then you have launch of the rotavirus vaccine. Then you have launch of the fractional inactivated polio vaccines, and launch of the MR vaccines, measles and rubella. So please remember these are 4 vaccines which have been changed. So you need to remember about the dosage, about the site of administration, and the time of administration under the universal immunization program. These few important updates are pretty important. So that's it for the health programs. Any questions or anything, you're most welcome to ask. For any kind of query, you're most welcome to WhatsApp us on this number 8699014009. That's our WhatsApp number. And For any kind of any question you have, you're most welcome to put it on Facebook. That is Mukhmohit Mukhmohit's Community and Medicine Discussions. So that's a Facebook group, and you're most welcome to post any of the comments or the doubts that you have on this group. Thank you, and thank you for watching this video. Please share with your friends. All the best.